The news has been dominated this week by the problems in debate over the Affordable Care Act.
It's not a question of gutting the law, it's a question of refining and tweaking it, just like all laws in this country have been refined and tweaked.
As the Affordable Care Act doesn't seem to take care of some things everyone thought going into it were going to be taken care of, now the Democrats do have to worry about their own seats in order for them to stay elected.
Tonight, discussions about what the Affordable Care Act means to Arizona residents. It's Arizona Week.
Production of Arizona Week is made possible in parts by a grant from the Stonewall Foundation and by the members of Arizona Public Media. Thank you for your continued support.
I'm Christopher Conover, sitting in for Michael Cheehawk. This week we saw the first release of numbers from the White House of how many people who have signed up for insurance under the Affordable Care Act. That was followed by President Obama announcing health insurance plans that don't meet federal requirements will not be canceled for a year. And today, U.S. House Republicans passed a bill dealing with those canceled insurance plans. Joining us to try and sort out all the politics is Dr. Kate Kenski, a political communications specialist from the University of Arizona. Thanks so much for coming in.
Thank you for having me.
So the latest development we've had is this House vote. The interesting thing is 39 Democrats crossed the aisle, including two from Arizona, Congressman Barber and Congresswoman Sinema, crossed the aisle and voted with the Republicans. What does this say about the politics of the Affordable Care Act?
Well, I think there's been obviously quite a bit of fallout for Obama specifically, and a lot of the Democrats who were behind him in passing it. And some of the concerns, of course, is that while Obama doesn't have to worry about re-election, many of the Democrats do. And as the Affordable Care Act doesn't seem to take care of some things everyone thought going into it were going to be taken care of, now the Democrats do have to worry about their own seats in order for them to stay elected.
Is this single vote enough to throw off the dogs a little bit for these Democrats that crossed over, assuming politically is why most of them crossed over, because they're in tough seats?
That, it might be a case too of, and it's hard to know motivations. It could be that, they looked at it and they said, well, wait, this isn't what I signed on for either. And so there could be a bit of that. Is it enough? That's hard to say, because this really has been supposed to be, the signature piece of legislation, for this era. And since it has, not turned out smoothly by any stretch, that has been a huge problem.
You talk about this as the signature piece of legislation for this era. We've seen this before: Medicare, Medicaid, Social Security. When they rolled out, did we have similar problems and political problems, or is this just a new part of the era we live in?
Well, I think part of it is the era that we live in, to the extent that when errors happen, we know about them instantly, and unlike ever before. And so that could be part of it. Changes are, undeniably hard to do, and we have a much bigger nation than when those previous pieces of legislation were put into place. Nevertheless, the bottom line is that when it was passed, the Democrats were confident, or at least they said that they were confident that it was going to work out. Not everybody knew what was in it, but there seemed to be a lot of faith that it was going to go smoothly. And so they're being held accountable for what they passed, regardless of the era.
You and I have talked lots of times about voter behavior, and we both agree you never want to try and predict it, because you can never predict what a voter will do. But coming into midterms, will the voters be holding Democrats responsible for the website problems on the rollout and all of those things? Even Democrats, for example, like Ron Barber and Kyrsten Sinema, who weren't in Congress necessarily when some of this stuff initially went through.
Well, and again, it is hard to predict, but one of the things is that people do tend to operate on basically a heuristic level. That is, what they do know is Affordable Care Act, Democrats, those who opposed it, Republicans. And that's enough to question, should I continue supporting the Democrats, even if this particular Democrat may have not been the one who passed it? Did he or she make statements that suggested that the legislation should not be stopped? Which brings us in some sense back to the discussions during the government shutdown, when there could have been an opportunity to revise at that time.
Let's talk about President Obama. He's coming into the midterm elections. That means he's coming into his lame duck portion of his presidency. With the problems that we've seen, is his presidency really going to stall, assuming that the House and Senate majorities remain more or less as they are, or at least partisan-wise as they are, if the Republicans pick up seats?
Well, ultimately, history is not on his side. If you look at second-term presidencies going back for the last 60 years, for the most part, once a president has gone down and it's installed at a certain level, recovery is quite hard. And you do need some recovery in order to have the credibility to move forward on other important pieces of legislation. And so I would say overall for Obama right now, things do not look particularly good. Now, if we turn the clock back, a couple months, it seemed like, the battle between Obama versus the Republicans was such that he'd won the showdown. And I think everyone was pretty happy if you're on the Democratic side with where he was at. Now that's not the case, but we do need to keep in mind that whenever you vote, it's not just voting against someone, you have to also vote for another side. And ultimately, the Republicans have had a lot of struggles the past several years when they have had great opportunities to do things, and yet, for example, the 2010 midterm elections, they underperform. 2012, they underperform. And so depending on the choices they make, it may not be as bad for Obama in the end. We'll have to see.
Thanks so much for joining us and trying to explain some of the more complicated parts of the politics on this.
Thank you.
Healthcare also has a big impact on the economy. To look at that part of the issue for Arizona, we sat down earlier this week with University of Arizona economist Gautam Gowrinsankaran, who specializes in healthcare and economics. Discuss, if you can, some of the economic assumptions in the Affordable Care Act and what makes it work economically or not work economically.
Well, the Affordable Care Act is a market-based system, and the basic premise of it is that Americans should have health insurance, and then we have to find a way to pay for that health insurance. And along the way, we have to find a way to try to lower the cost growth of healthcare, to bend the cost curve, if you so to speak. So the Affordable Care Act does a number of provisions to try to make everything work together. And one of those is it's a decentralized approach. So it's a market-based approach. And one of the things that they do is to create these health insurance exchanges. That is what we've heard a lot about in the news recently, the ones that opened on October 1st. And the idea of health insurance exchanges is to create a marketplace where insurers will offer to supply health plans and consumers can buy the health plans. And to create that marketplace in a way that's standardized. So they have 3 different types of plans: bronze, silver, and gold. And that makes it a lot easier to work than if you were trying to shop for health insurance plans and you have to read 1,000 pages of documents to understand exactly what the coverage is going to be. So all of that is what the law really does well, is to unite the consumer and market side and sort of make the markets work by having these transactions work well. And I think that's really the strong points of the law. Now, where we've had some technical difficulties has been that there's a lot of complexities in how subsidies are calculated and who's eligible for subsidies, based on income, based on citizenship status, all those sort of things. And so just the reason that, my understanding is that the reason it's been so hard to straighten out all the IT problems is because they have to link together 1 million databases to try to evaluate who's eligible and what prices they have to pay for their health plans.
Of course, health insurance, the medical industry as a whole, health insurance ties into that. Big economic engine or part of the nation's economy. Getting people on health insurance, does that help with the economy, or does it just have no effect in it?
Well, I would say that it can help, but not, we shouldn't expect a short-term economic boost from getting people on health insurance. The reason to get people on health insurance is so that they get health care, and so, they don't get injured or die or lose vitality or suffer from chronic illnesses. So there's more a moral right to do that. And the thing is people were already getting health care, so emergency rooms had to treat people and et cetera. There are various ways that people are getting health care, and this rationalizes the way that people get health care, and that will help with the economy. But we shouldn't expect like a short-term economic boost from it. But in the long run, this is the way that people get health care. I believe in markets, and I think that the way that people get health care in the Affordable Care Act is through markets, and that's going to make the process more efficient. That is going to help the economy in the long run.
We've had these exchanges open for at least applications for about 6 weeks, as you touched on, and everybody knows there have been a whole host of especially IT problems, but the first numbers came out this week. In Arizona, for example, they had 750 people actually get into these healthcare marketplaces, and about 33,000 apply. We'll assume that there's some paperwork backlog, as we've heard. Is this about what we would expect 6 weeks in, or is this, as opponents of the Health Care Act say, it's a failure, and this just shows it's a failure?
Well, let me answer that in two ways. First of all, I'm not an expert on how many people will enroll, but within 6 weeks or within 12 weeks. I mean, I don't think the healthcare coverage starts till March 1st or April 1st, if I'm not mistaken. So, if you're like me, you're probably going to wait till February 27th or 28th to do it if it starts March 1st. Now, maybe some people are a little more forward-looking than me, but I doubt it. So, so I think that you can read in the newspapers as well as I can that people said that the administration projected that more people would sign up for these, et cetera. But that's, by this time period, that is. But I think the real way to gauge a failure or efficiency of a marketplace is it providing products that people want at the right prices? And I think if you look at that case, it's been a real success. There's a lot of health plans provided in most states, including Arizona, I'm sure. And the prices for those plans are pretty attractive. And that's what we want in healthcare, is the options to buy health insurance, good quality health insurance that's understandable, that covers the things that need to be covered at good prices. So I think in that way it's going to be a success, and I suspect that a year from now we're not really going to remember all these sort of very short-term challenges. My other answer to that question is that I believe in markets. I also think that people have a right to I think that we have a moral obligation to provide health care to our citizens as one of the richest countries in the world. Not Cadillac health care, but at least basic health care to citizens. But I believe in markets, and I think that if you're going to think about not having, if you were hoping that markets fail, that the health insurance exchanges fail, well, then what's left? I mean, if you think, well, markets shouldn't work, then I would say the alternative to markets is government control. Government regulated, government saying, here are the prices. Everybody gets this. We're not going to have a private system where we let the market compete to lower the prices, and that's not what I'm in favor of. I suspect that various politicians who are criticizing the Affordable Care Act, that's not what they're in favor of either.
We'll have more of that discussion later in our program, but now we turn to people on the ground. Joining us are Elias, a navigator at St. Elizabeth's of Hungary Clinic, who's helping people get into the insurance marketplace, and Julia Strange, the Vice President of Community Benefit at Tucson Medical Center. Both of you, thanks so much for coming in. Luis, let's start with you. We've heard a lot about in the news about the problems with the website, people not being able to get in. You're a navigator. Tell me about the experiences you've had getting people signed up to get into the marketplace.
Well, initially when the website went south and we started having problems with it where we couldn't actually navigate through the website, and then the Health and Human Services people up in Washington pretty much said, it's got some glitches in it, it's broke, we need to go in and fix it. We immediately got together, we had a meeting, and we said, okay, how are we going to proceed here at ground level? What are we going to do? Because we need to get our consumers / patients going in this, and how are we going to plan this? So what we've been doing is we've been doing a paper application. It's much easier. So we're still setting up appointments for individuals coming in that want information. We give them the information, and at that time, if they decide during the scheduled appointment that they want to proceed with the application, then we'll help them fill out the application. If they bring in their information, when we set up that appointment, we'll make copies of the information, attach it to the application, put it in a marketplace envelope, seal it for them, tell them to put a stamp on it and mail it out. Then we tell them to wait for their letter from the marketplace, letting them know if they're going to be eligible to proceed to the next step. The next step, of course, is going into the site, selecting a health plan that fits their medical needs once they've done their homework with the insurance plans or the insurance companies and the plans that are available in Pima County. And then finally selecting a premium that they're also going to be financially secure with. So at this point, that's what we're doing. We have not, or I have not at this point, been able to select a plan for anyone. So we're waiting to see what happens with that website, and hopefully come the end of November, as most of America was told, it would be somewhat, navigable to go through there. And if it's not at that time, then we'll wait another week or so and see if we can get back in there.
Julia, let me ask you, you're at a big hospital here in Tucson. People may not think of that as a place to go and get information. You have people who are available for information, but what's the hospital doing with all of this as it starts to come online?
Tucson Medical Center, we're a nonprofit community hospital, and we believe that we have an obligation to help the community understand this important historic legislation act that is being implemented now. We are currently spending a lot of time out in the community talking to people about the opportunities that are being provided through the marketplace. And we will, in the beginning of December, start our certified application counselors will begin to actually going through the enrollment process. And we'll be having a series of enrollment days where people will be able to come in, make appointments, and get through the process. And we're going to start that in December. Right now, very active conversations in the community at all of the outreach events that we do about how to get insurance through the marketplace, and also through Access and the Healthy Plus, because this is both the marketplace and also the expansion of Medicaid. So there's a lot of opportunity, and people have a lot of questions, and so we are available. We're taking those questions, and then again in December we will start actively doing that enrollment.
What are you hearing in the community when you're out talking to people, good, bad, about the overall plan?
Almost universally, it has been people are interested. They have questions. They've got concerns about the website, but overall, they are enthusiastic about the opportunity that is before them to have insurance. Sometimes for the first time in a year, 2 years, 3 years, and sometimes in their whole life. This is an opportunity to really get that insurance that will provide them some coverage, so that when they face their medical crises and or just their regular preventative care, they're able to better manage their health. People are positive and, in general, curious and enthusiastic.
And Luis, you are dealing with a lot of the population here in Tucson, but you're also doing a lot of outreach. You were telling me that this weekend you're doing a radio show aimed at the Hispanic audience.
Exactly.
What are you hearing with your clients?
We're hearing it again. It is positive. I have not heard anything negative about it yet. We're taking that step also where we are actually pre-screening our consumer patients and see if they're eligible for the state Medicaid for Access. Because those patients or consumers that are eligible, we're going to put in the Access program first. That way, if they're eligible, they don't have to pay that premium. They don't have to go into the marketplace. Because that's actually one of the exemptions, is if you currently have medical coverage through either state Medicaid, Medicare, or any of the other services, you don't have to go into the marketplace. So that's what we're doing first, and we're targeting that type of individual first, so that we can put them in that Access program if need be. All others are actually coming to us. All the other individuals that are interested in the marketplace, they're making phone calls because they're interested, and they know already that they don't qualify for Access because they've already tried to become determined by the Access program. So it serves two things. Tomorrow, we're doing a radio interview, and it's to target that Hispanic community. And I think that at this time, they're probably the most misinformed. I get several calls in my office asking me, why do I have to pay a premium for access? So those are things that we have to answer. And of course, we know that there is no premium for access. So people are misinformed, and my job is to go out and do the outreach, go into the community and teach them and explain to them, give them the knowledge that they need to be able to proceed.
All right, well, thank you both for coming in. We appreciate the information you've passed along to our viewers. We now return to our conversation with Dr. Gowrinsankaran about the economics of healthcare. The president is starting to tweak this a little bit more. He came out today just before you and I sat down and said that he's going to delay the expiration notices for another year. Is this just growing pains of a big system that we've never had in this country before? Or again, is this a sign of problems and the law as a whole needs to be, I don't want to say gutted, but largely reworked?
Oh, I think that and that's, well, on that specific issue, I think that he is that it's just a sign of a minor tweak. Now, the reason these health plans were canceled, my understanding that the reason they're canceled is because they didn't provide coverage that people thought they were providing. So, so in the Affordable Care Act, we have plans that are pretty bare bones, which is I think it should be, that we shouldn't force people to buy Cadillac coverage, but we should force them to buy bare bones coverage. But we do include, we made a policy decision that we include mental health care, a couple other categories like that. So existing plans may not cover those categories, and that's probably part of the reason why those plans won't be available under the Affordable Care Act. In addition to that, the other plans, they're there. Sometimes people bought plans that they really didn't know what they were getting. Like there would be a health insurance plan, but it would have a $2,000 maximum coverage, and people thought they were getting health insurance, and then they get cancer, and they realize, boy, all I got was a maximum of $2,000, and the treatment for cancer is going to cost $20,000. And those plans should be eliminated. And I think, but I think as an interim solution, it's okay to have those plans, stay for another year, just more to ease the transition than anything else. But as a general principle, when you have a law as complicated as the Affordable Care Act, as a law where they're setting up marketplaces with whole bunches of details like IT systems and subsidies, and we don't know exactly what's going to perfectly work. I think laws need to be tweaked, and I hope that politicians in this country actually get together and figure out how to optimally tweak the laws. I mean, there's going to need to be, for the Affordable Care Act to work well, there's going to need to be many more tweaks than just this one. And it's not a question of gutting the law, it's a question of refining and tweaking it, just like all laws in this country have been refined and tweaked.
We saw the government shutdown earlier this year. It was somewhat tied to the Affordable Care Act, with the Republicans trying to pull the money from it. If opponents in Congress are successful in defunding at some point this act, be it in the near future or somewhere down the road, can the act really go away, or are we too far down the road, both politically, economically, societally, to actually get rid of this?
Well, I don't know what the answer of whether it will go away, but I do think that Republicans in Congress, if they want to defund it, they need to come up with an alternative to it. So there's, and I think that right now they're just focused on defund, and not really, well, what's the option? Now this is an act that's saving money for the government and that's doing a lot of things. I don't think you can just defund it and go back to the status quo. So I've read conservative columnists like Russ Douthat for the New York Times, who I really appreciate his views and think they're very thoughtful and agree with a good number of them and not others. But he mentioned an alternative, which is that the government would provide catastrophic care for people and then have high deductible plans for other people. Now, I would argue that that's actually quite a minor tweak from what we have in the Affordable Care Act, that the bronze coverage, which is 70% coverage, 70% of expenses, and a deductible of, I believe, up to $9,000, is really very similar to what Russ Douthat is advocating as the right solution. But if you don't think it's the right solution, you think the deductible should be $12,000 and the coverage should be 60% instead of 70%, then by all means, I think propose that as an alternative and say we want catastrophic coverage to replace the Affordable Care Act. We want to tweak it, reduce it from the bronze to the lead plan. I don't know what's the 60% level, but and go with that. But we need to have some solution, and it's not like there are no conservative solutions out there. And there's certainly aspects of the Affordable Care Act that I find too liberal for my taste, and I would prefer more conservative solutions. But no solution is not, in fact, the conservative solution. It means letting Medicare, which is a government-funded command and control program, grow without control. That's hardly a conservative solution. So I hope that I don't know. I don't think that they're going to be able to just repeal it 2 years from now, and I certainly hope that they don't, and that instead of that they come up with some genuine conservative ideas that would actually help this debate.
You're doing research in Chile right now, so you get a little bit different view maybe of what's going on here in this country. What is the view from the rest of the world, or at least part of the world that you're doing research in right now, about all of these arguments that are going on?
Well, it's interesting. The view from people I talk to in Chile is that in the U.S. they say, politicians do a lot of talking, and the different parties come into power, and there may be a lot of talking. But from Chile, what we observe is that the policies in the U.S. they're pretty constant over time. And that's actually a good thing. It's a reason the U.S. is successful, that it doesn't sort of veer from left to right in the policies. And I think that's actually was a surprising thing to hear from people in Chile, where they feel that in Chile, and certainly more in other South American countries like Argentina, the economic policies have just veered crazily from left to right depending on the government. I think one of the things in the U.S. is that despite all the talk from politicians, we do have a general consensus about what's going on. And if you look at the policies of President Obama, they're not all that different than the policies of President Bush before. I mean, don't forget that President Bush, a Republican, of course, President George W. Bush, implemented the Medicare Modernization Act that established Medicare Part D, which is drug benefits for senior citizens, right? And that was the biggest expansion in Medicare that we've had since 1969, when Medicare was established. So I think that even though politicians in the U.S. like to talk, one of the things I've appreciated from being in South America is that we actually have a more functional governing system than you might think from being in the trenches here in the U.S.
And that's our program for the week ending November 15th. Michael Chihak will be back next week. I'm Christopher Conover. Thanks for tuning in.
Production of Arizona Week is made possible in parts by a grant from the Stonewall Foundation and by the members of Arizona Public Media. Thank you for your continued support.